Hey guys, it is January the 2nd, and I'm on my third or fourth take at this point now. I actually tried recording this twice outside, and I started recording it, and it was just way too cold. It's a pretty cold day here in South Carolina. It got down in the 20s last night. This is not the kind of weather we are used to around here, and I was sitting out there trying to film. My teeth were chattering together, and I just couldn't talk. So anyway, I decided just to go back inside the house, and I'd be able to talk a little bit clearer. So anyway, thank you so much, everybody, for watching the video I did yesterday. I know that was a little bit off topic, but I just figured I'd do something a little bit different and give you guys a little glimpse into my life and where I live and all that good stuff. And thank you so much, everybody, for all the really sweet comments everybody gave me. I mean, so many people were telling me how nice my place is and all that stuff, and it was just, it was really nice to hear all that. You guys are just so kind. Everybody in this community has just been so nice to me, and I really appreciate it so much. I mean, you have no idea how much that makes my day when I see stuff like that, and I keep seeing the same people over and over again, and new people in there. But for those of you who have been here for a long time, well, I mean, I haven't been doing this for that long, but for the ones of you that have been here since the beginning, thank you so much. All the new people that are coming in, thank you so much. All of you all across the world. I mean, it's just crazy. I mean, I'm just a normal guy who lives out in the middle of the woods here in South Carolina, and I've got people all over the world watching this channel, and it's just crazy. I mean, it really is. My beard is just messed up today. But anyway, I figured with what I have going on, for those of you who are just getting on this channel, it's the first video I've ever watched. I've been a really bad alcoholic my whole life up until a year and 7 months ago. I got sober. That was due to the fact that I was hospitalized with pancreatitis, liver failure, a whole slew of things. Found out I was diabetic. And since that initial hospitalization I had, I've been hospitalized multiple more times. I actually quit drinking, and then I ended up getting pancreatitis a couple more times after that. Found out that I have chronic pancreatitis and a whole bunch of other things. But anyway, the purpose of this video today is that, I've got the surgery coming up in 2 days. On January the 4th, I go down to Charleston at MUSC, and it's a teaching college here in South Carolina. And I'm going down there for a pancreatic procedure. They've been trying to basically rebuild my pancreatic duct because I had a total blockage in my pancreas. I had numerous pseudocysts that were growing on the outside of my pancreas, so they had to drain those off. My pancreas was just really, really, really swollen. I got pancreatitis again back in April, I think it was, of this year. Well, last year. Now, back in 2023, and after that hospital visit, and they discovered that I had a pancreatic duct blockage. There was a total blockage in there, so the pancreatic enzymes couldn't escape my pancreas, and basically what was going on is my pancreas was eating itself. And the first thing they had to do was get that drainage off of the pancreas, off the pseudocyst, and then they had to put a stent into the tail end of my pancreas to drain into the stomach to relieve that pressure. And because they tried putting a stent into the pancreatic duct, and it was just way too swollen at the time, and they tried doing it again, didn't work out. So they went ahead and did all these other things to try to reduce the swelling of the pancreas, and then they were finally able in September to get a stent in that duct. Went back November 14th of 2023, just a couple months ago, and they were able to get 2 stents in. And this next procedure when I go in this week is going to be, they're pulling the 2 and replacing it with 3. And from what I understand, I've got a whole year's worth of procedures that they're going to have to do, at least 4 procedures left. But we're just going to have to wait and see how everything works out. I mean, nothing's set in stone. I mean, they can wish that something's going to work out one way. Doesn't always mean that it's going to. And that's happened to me multiple times. It's just to be expected. So I'm just going to have to wait and see what happens with that. But since I'm going to have this procedure done, and the pancreas has been on my mind so much recently, and I'm just getting these memories are coming back of the procedures that I've had. To be quite honest with you, I'm really terrified of going back in here and doing this procedure. At this point, I know I've got some kind of trauma with this. I do have uh, some serious anxiety that happens every time I go to the hospital now, because I've been through so many procedures and they're so painful, and I am like really scared to have to go deal with this again. The last time they did it, I woke up and I mean, I could barely talk. I was in so much pain. I just could not stop crying and screaming. But anyway, so with all that on my mind, I figured today would be a really good day to make this video. And the video today is going to be a lot based on pancreatitis, but partially just how dangerous alcohol really is and the damage that it causes to our bodies. And one thing I just wanted to, before I start into this, I just want to give you guys some numbers real quick here, because I think these are really important. So, why is quitting drinking so serious? Well, in the United States right now, and if you're not living under a rock, then you know about the fentanyl epidemic that's going on in our country right now. This is not new news. This has been going on for quite some time now. You know about the Mexican cartels and the fentanyl and all that stuff, and they're putting it in everything. So basically, like, anything that they can slide fentanyl into, they're putting it in there now to intensify the drug. So, people are getting cocaine, it's got fentanyl in it, fake pills have fentanyl in it. From what I understand, they even say they're finding fentanyl in marijuana now. I mean, it's just in everything. So in the United States right now, with this huge epidemic that, I mean, it's on the news every single day. They're talking about it all the time. I mean, they are just banging on the table about this. So in the United States, and I'm not saying this is a small number or anything, because this is a lot of people, but 80,000 people a year die from fentanyl overdoses in the U.S. I'm not looking at worldwide numbers, except for one number, which I'll give you in a second. But in the United States, every single year, that's 80,000 people a year from fentanyl. But from alcohol, there's 140,000 people that die every single year from alcohol disease or alcohol-related diseases. That's 60,000 more people a year pass away from alcohol-related diseases opposed to the fentanyl. That's almost twice that number. And I don't understand why we keep beating this horse about the fentanyl. And I understand it. It's a problem. But if you have this other number that's this large, why are we not talking about this? And why are we not discussing alcohol? It just blows my mind. Worldwide, every year, 3 million people pass away from alcohol-related disease. That's not a small number. I mean, that's like a small country's population dies every year from alcohol-related diseases. That's huge. I mean, that's a lot of people. And you don't see it on the news, them talking about alcohol, the risks of alcohol. You might see it every once in a while, but we're just not discussing it. And that's the reason for this channel, is to talk about the dangers of alcohol and what can happen from it. So, just one alcohol-related disease is what we're going to be discussing today, and that's pancreatitis. Now, alcohol does not always cause pancreatitis. There can be other things that can cause pancreatitis, and I'll get into that in a minute. But pancreatitis is basically where the enzymes begin to activate in the pancreas before they leave the pancreas. And sometimes there can be a pancreatic blockage, which is what I have going on or have had going on, to where those pancreatic enzymes can't get out. And a lot of times it happens because the pancreas can swell so much that it'll close that pancreatic duct, and those enzymes stay in the pancreas. And what ends up happening is something called autodigestion. Those pancreatic enzymes are made in our body to help break food down, and especially fats. And when they sit inside of your pancreas, well, it starts to actually digest itself. That's what causes the pain and all that. So one day I'd had my test procedures back in January, and I ended up having a hematoma in one of the spots in my groin where they had gone in with the intervention. When interventional radiology went in, they did like 6 different places that they went in through. It was through my neck, my belly button, the side where my liver's at, my groin. But anyway, they had to go in there and fix it because I had hematoma. I woke up like 2 days later and I had like a ball on the inside of my leg size of like a softball. I was just like, what in the world is going on? So I called them in. The doctor came in, and it was actually one of the surgeons who had done my procedure the day before. And it was a Saturday, I remember, because he wasn't even supposed to be there. He'd actually come in to see another patient and just stopped by my room to see how I was doing, and I pointed that out to him. So he ended up staying there that day to address my hematoma. So they had to go in there and do like close that. It was basically bleeding on the inside of my leg and filling up with blood. So they had to fix that. Well, while we were sitting there going through this, I was awake while we did it. He actually did it in my room. And while they were doing it, I was talking with him, and I said, what's something that like one of the big like rules, like cardinal rules that you guys have in surgery or whatever. And he said the one rule that we have is you never touch the pancreas. He said we actually have 3 rules: don't touch the pancreas, don't touch the pancreas, and don't touch the pancreas, because the pancreas is that sensitive. So when you do have pancreatic issues, it's not to be taken lightly. I'm telling you, it is no fun at all. It is very, very painful. But things that can cause pancreatitis, one is gallstones that can, come out of the gallbladder, and your gallbladder and your pancreas basically sit side by side, and then, you got your small intestine right there, and the gallstone can drop from the gallbladder and then get stuck inside of that pancreatic duct, and it can do a complete blockage. Medications can cause pancreatitis. Infections can cause pancreatitis. Tumors can cause pancreatitis. Alcohol consumption can cause pancreatitis. Genetics and high triglycerides also can be factors in causing pancreatitis. The pain, it radiates from your stomach. A lot of times you'll feel it. Well, me personally, I always feel it right here in your left quadrant, right by the ribs. But it can move over, and you can feel like you're getting pain in your liver, but it's actually the pain radiating all the way over there. I forget what that term's called, but it's where it's like displaced pain. You might like hit yourself in the head and your knee hurts or something, just for instance. But basically what's going on is your pancreas hurting, but you start feeling it in other areas. So it will move over to your liver area. You'll get pain all the way across your chest, and then it like right below your ribs, and then it will radiate to your back as well. You'll have vomiting, absolutely no appetite at all. You do not want to eat anything. Fever, which has happened to me multiple times. You can have internal bleeding from it, and there's a host of other couple things that can happen as well. How do they know that you have pancreatitis? Well, if you do feel like any of these things are happening, you definitely need to go have medical attention immediately, because pancreatitis can be life or death. What they'll do is they'll take blood and they'll check your pancreatic enzyme levels, and it's amylase and lipase are the enzymes they're looking for. I know the last time that I had pancreatitis, my doctor, my wife had called him and told him I was really ill. It's my GI doctor. he said before I even come to the office, I need to go have my blood drawn. I went to another hospital, had my blood work done, and then went straight to the doctor's office. And when I got there, I was only there for maybe 10 minutes. I walked back to the back. He had my numbers right there in front of him. He pulled them out, looked at it. He goes, your lipase numbers are way out of whack, man. Go to the emergency room. And I went straight over there. I mean, he told me from the office just by looking at my numbers, I had pancreatitis. And then, of course, I went to the hospital. They did some more tests and found out that that really was what was going on. But they can do MRIs, CAT scans, sonograms to take a look at your pancreas to see if it's swollen. But they can determine if you have pancreatitis rather quickly. There's really not a whole lot of tests they have to do in order to find that out. The stay in the hospital from pancreatitis can be anywhere from just a few days to a week, 2 weeks, but that's normally about it, just depending on how bad the pancreatitis really is. I've never gone in the hospital for pancreatitis, say less than a week, but like I said, I have chronic pancreatitis, and my case is just a little bit worse than acute pancreatitis is. People that just get, a bout of pancreatitis first time or maybe second time. When I get it really bad and end up in the hospital. And the doctors have told me, since all this has happened, it's not a matter of if I get pancreatitis again, it's just a matter of when. And from what they've told me, I'm probably looking at getting pancreatitis somewhere around once a year, and that's just the bottom line of it. What they can do to fix it, they can go in there. They might have to. Now, a lot of times you can just go to the hospital, and what they'll do is golly, I can't remember the name of that term, but nothing by mouth is and there's an actual term for it, but you're not allowed to have anything to eat or drink for a few days. And basically what they're trying to do is they're trying to keep your pancreas from getting activated. And so what they're going to do is they're going to give you an IV, and fluids are very, very, very important at this stage. You really need to get fluids in your body. They do not want you taking them in by mouth. They need to get those fluids into your body. And depending on what's going on with you, they're probably going to maybe throw a little bit of some other stuff in there, maybe some vitamins, or they can put antibiotics in your fluids and all that kind of stuff. They can go in there and they can, if it was a gallstone, they can do a procedure, most likely an ERCP, where they go down through your mouth, down through your throat with a camera, and they've got like little arms and stuff that they can get in there. They'll try to remove those gallstones out of the pancreatic duct if that's what's going on with you. They can go in there and they can drain those cysts like I just talked about by putting stents in the cysts and then letting those drain. They might actually even have to remove part of your pancreas or either all of your pancreas, depending on how bad your pancreatitis is. Most likely, if you have acute pancreatitis, you're probably not going to have to deal with any of those situations. It's really when you get into the chronic pancreatitis when you start getting into these areas of removing the pancreas and things of that nature, which are things they have discussed with me. I hope that never happens. But my doctor has told me that if these procedures that he's doing, if I continue with the stomach aches and this is just not working, that the first thing they're going to do is they're going to put a feeding tube into my small intestine. And then they're going to, I'll have to go on what's called pancreatic rest for 8 weeks. And then I guess they'll see what happens from there, or they might have to remove my whole pancreas. At this point, my pancreas isn't producing insulin. I'm completely insulin dependent. I have to take insulin with every single meal that I eat. So I take fast-acting insulin with every single meal, 15 minutes before I eat with a sliding scale. And then at nighttime, I have to take long-acting insulin that lasts the whole night into the next day. And I also have to take another medication called Jardiance. There's another medication called metformin that works with your liver. I have liver disease. So with my liver disease, they don't want to put any more strain on my liver than there already is. So the Jardiance, the medication I'm on now, it works with your kidneys and it removes the sugar out of your blood and then you urinate it out. And continually getting pancreatitis or having pancreatic issues can definitely lead to development of diabetes as well. It can be a really big contributor to that. So that's something else to look out for. If you've been having a lot of pancreatic problems, you've had pancreatitis in the past, your chances of getting diabetes are way up there. So after the diagnosis, what they're going to tell you, basically after they let you leave the hospital, they're of course going to tell you no more alcohol and no tobacco. I'm not really sure what role that plays, but I know it's not good for your pancreas. I don't know what the mechanism is and why it's bad for it, but I know the alcohol is really bad for the pancreas. They're going to tell you to restrict your fat intake and that you're really going to want to eat low-fat foods and certain lots of fresh vegetables and fruits. And they might remove you off of certain medications that you're on as well. That, like, I know at one time my endocrinologist had me on a medication that worked with my pancreas, and it basically kick-started your pancreas to create insulin. I think it was called like Starlight or Star Bright or something like that. It had something in a star in it, but anyway, after all this happened, I was taken off that medication. I was actually on another medication as well that made my pancreas initiate, and that one right there, I think actually might have caused one of my bouts of pancreatitis I had, and I got taken off of that one as well. Actually, after I had gotten that bout of pancreatitis, I went back and did some research and found that the medication that I was on actually can cause pancreatitis, and it's been known to do that. And I was just blown away after I had already had pancreatitis that I was even put on that medication. But I'm not the doctor, but just a little bit of research that I did, so I found it on the internet like so fast. So I would suggest, and we do this all the time, my wife and I are constantly looking at medications, interactions, all that kind of stuff that can happen. Just do your own research. I'm not saying that, doctors and pharmacists and all that stuff don't have the best intentions in mind, but you have to think, sometimes they might miss something. I mean, they have a lot on their plate as well. Look out for yourself and do a little bit of your own research. You'd be surprised some of the things that you might find. Now, I definitely wouldn't walk into your doctor's office and say, "Doctor, I found this on Google," because you're not going to make them very happy. I know my wife does it all the time, and we'll go into the doctor and she'll say, "I looked this up on Google," and the doctor go, "Okay, what did Dr. Google say?" And you can just see their eyes. I mean, they literally roll back into the back of their head, and they almost pop out when she tells them that. So I would not suggest on your doctor that you've been Googling things, but it could be something you just bring up. Hey, I've got a question for you. I heard this somewhere or whatever, but do your own research. Look at your own medications that you take, and just, look into it. It's not going to hurt anybody at the end of the day, but you actually might find out something that somebody might have missed, and you just never know. I mean, medical malpractice happens all the time, and there's all kinds of crazy things that happen. I mean, people leave scalpels inside of people when they, surgeons leave them in there, or there's just crazy things that happen. So don't think for an instant that they might make a mistake and not realize that one of your medications might really interfere with another one, or vice versa. Just do your own research. But anyway, the thing is, drinking is a very serious thing, and it causes a lot of health consequences. And I'm living proof of that. I've had so many health problems because of the amount of drinking that I used to do. And I know that drinking can be fun and you can have a good time with it. But at the end of the day, it's just not worth what you're going to have to pay at the end of it. I mean, it's just like taking a ride. Except this ride, it's like going to the fair or something and getting on a roller coaster ride. And you don't pay before you get on. You get on the ride, it's fun, it does all kinds of fun stuff. You go up and down a bunch of hills, go through some loop-de-loops, all that kind of stuff, but you don't pay until the end. And you don't know what the price is going to be when you get off. It could be $1, it could be 1,000. You don't know. And that's the same gamble that you're playing when you drink. You just don't know. You might be one of the lucky ones. I mean, I've known people that drink their whole lives and are old men now and haven't had one problem because of drinking. But here I am. I was 42 years old when I first got sick, and I'm 44 now, and I'm still dealing with all kinds of health consequences because of it. It looks like I'm probably gonna be like 45 when this is all done. If this is done, I don't know. But I just want to make you guys aware, especially those of you who are sitting on the fence right now and you're not sure what you should do, and you're really thinking that you might have a problem or maybe you don't. I'm telling you, it's just not worth it. The price that you have to pay is not worth it in the end. With that said, I'm going to keep saying this over and over again, that if you do decide that you want to quit drinking, seek medical attention, please. Speak to a doctor. There are all kinds of medications that they can give you. I mean, we've come so far with our medical advancements these days. They've got medicine. They've got things they can do for you. Delirium tremens is a real thing. Withdrawals are a real thing. And there are real consequences behind just stopping abruptly alcohol without having medical attention. When I first was put in the hospital because of my drinking with all the health things I had going on, the first week I was in the hospital, I was on all kinds of medications to keep me from going into withdrawals and all that stuff. And I don't really remember a lot of that. Actually, I don't remember anything really from the first week. And I don't know what the drugs they gave me were, but I didn't go into withdrawal. And I think if I'd gone into withdrawal during that period of time with this as much trauma as my body was going through at the time, and as sick as I was, I don't think I'd be here talking with you guys right now if that was the case. So anyway, I think that's about it. I just wanted to talk about that really quick. There's a couple reasons why I wanted to discuss this video today, and I'm not going to get into all of them, but more or less, one of the biggest reasons I'm discussing this is because of what I'm going through right now, the procedure I'm about to have, and the power's in your hand, and you have all the control in the world to prevent that from happening to you. Like I said, there are other situations that can cause pancreatitis that are not alcohol related, but you greatly reduce the chance of yourself getting it if you cut the booze out. With that said, guys, tomorrow I'm leaving here, heading down to Charleston to go have my procedure done. I'm leaving tomorrow. We're going to stay in the hotel. I'm leaving my mom. I am going to film a video tomorrow. I might actually try to make it just a little short video of us traveling down there. We're supposed to stop by this little restaurant that's actually ran by Mennonites. It's in a town called Blackville, South Carolina. It's called the Bread Basket, I think is the name of the place, but they serve like super good southern food, all prepared by the Mennonites and everything. It's supposed to be a really good place, and they were going to stop in there for lunch on the way down tomorrow. And then when we get down there, we're going to check into our hotel, and we might just go check out a little bit of stuff in Charleston while we're there. But then I've got to get to bed at a decent time tomorrow night because I've got to be at the hospital at 7 a.m., which means I got to get up about 5 to get ready, and then we got to drive over there. Not looking forward to that. I'm going to be filming while I'm there. I'm going to film myself before the procedure. I'm going to film myself after the procedure. There's gonna be a couple of videos that are gonna get uploaded, and I just really want to share with you guys this experience, how painful it is for me, and what I go through. And I mean, honestly, if it scares somebody, then that's probably what needs to happen. I just want you to see that this is not something that you want to have to deal with. It really isn't. So anyway, guys. Thank you so much for watching the video today. I love you guys so much. I really do. You guys are so awesome. Thank you so much for all these super nice comments you guys gave me yesterday in the video I did. If you haven't subscribed to the channel, please subscribe. I do these videos every single day. And like I said yesterday, I talked about alcoholism, pancreatitis, liver disease, and a host of other things. I mean, really, it's whatever is up for discussion for that day. And a lot of times I get ideas from people in the comments. Continue to give me those ideas that you guys have. Anything you'd like to see me talk about, I'm more than happy to do so. And with that said, guys, until tomorrow, you guys have a great day today. Thank you for watching the video. And once again, I love you all.